Turning now to the overdose crisis that's been growing in this country for years now. Well, we've learned that it hit a new high in 2021. The CDC said today that more than 107,000 Americans died from drug overdoses last year, the most on record. That comes out to 1 every 5 minutes. About 2/3 of those deaths involve the opioid fentanyl. We told you how dangerous it is, and this report shows how the crisis continued to get worse during the pandemic. Joining us live right now is Kelly Dumas, Chief Operating Officer of BestSelf Behavioral Health. It's great to have you on here. We shared those national statistics, but I wonder, does that increase in overdoses that we're getting in that report match up with what we're seeing here in Western New York, and what are the biggest problems that you're dealing with?
Hi, thank you, Michael. Yes, unfortunately, we have also experienced and noticed the increase in opioid overdoses in the region. And unfortunately, it's residual from the COVID pandemic that we're all still recovering from. And I think the biggest, you asked what was one of the biggest challenges, is during the last couple years, we have lost our regular way of connecting and engaging folks. And so figuring out how we can reconnect and re-engage with those individuals who really need our assistance has probably been one of the biggest challenges that we've been working on tackling.
We heard throughout the pandemic how, the isolation, the financial stress, so many things that were tied to the unintended consequences of the pandemic were making these overdose problems worse, exacerbating, the drug issues in our community. Now that we are emerging from the pandemic, right, we're far removed from lockdowns, few restrictions. Are we seeing any signs of improvement that isn't as much of a factor on people's mental health and everything that goes along with that?
I think we're still, as you mentioned, it's not as it was before because we're in a different phase of the COVID pandemic. So things are better, but they're not back to what they used to be. I'm not sure they will ever be. So people are still experiencing some stress in regards to their mental health. And the way maybe, so we're still using a lot of telehealth, and we do have in person. You have different variances of people feeling comfortable and safe coming in person to receive treatment. So there's a lot of factors that I guess that goes into assessing that. I would say it is improving. And we hope to see it continue to improve as we continue to reach out and engage those individuals and make sure we're accessible to them.
The report that we got today, again, putting into perspective an overdose death in this country every 5 minutes, it's a staggering number, right? And of course, it leads to the question of what do you do about that? What needs to change? And so I wonder, what you think we can be doing better as we go forward to try to turn down what is just such an awful trend.
Yes, well, we have life-saving measures available. There's Narcan, there's fentanyl strips that are really, they are so crucial in saving lives when an overdose happens. And so getting those into the hands of the community so that if you're with friends and someone overdoses, you can administer Narcan and hopefully save a life, but also looking again, as I mentioned, to make sure our services and treatment is as accessible as it was prior to COVID coming in. We learned, and we did a great job in this region with addressing the opioid overdose issue. And we learned that immediate access to services and treatment is what helps. And so we have to get back to making sure people can immediately get to prescription medication for their addiction and the treatment services without delay.
We've been talking with Kelly Dumas, Chief Operating Officer of BestSelf Behavioral Health. Such an important topic, and we got this awful news today, but we appreciate you helping us understand it better.
Sure, thank you.
All right, thank you, everybody.